So I'm just going to hit go.
Okay, this is my friend Pauline. She's a dentist, and I'm going to be interviewing her today. Hi, Pauline.
Ashley.
All right, so first question. Was a job in the medical field the original plan, or if not, what was?
Okay, so the job as a dentist was always the plan. My aunt's a dentist, so I started working at her practice when I was 12, and basically did everything from answering phones to like pulling charts and setting up rooms, and really didn't like it my first year because I was 12, and no 12-year-old wants to work in an office all summer. But I kept with it and kind of just fell in love with it. So it was really only plan. I just kind of went for it and it worked out.
Cool. This is Ford. Can you describe your educational background as well as your previous employment in the healthcare field?
Sure. So obviously, without including high school, so I went to Rowan University where I got my degree in just bio. Then from there, I went to NYU and got my master's in oral biology. And then from there, I went to NYU and got my doctorate in dentistry. So I'm a doctor of dental surgery, according to my letters behind my name. And after that, what I did was I did a 2-year residency at Mount Sinai Hospital in Harlem. So basically what that included was not only did it include like clinical work, but also included work in the emergency room and work in the operating room and working in different clinics for different types of patients. So my first year in residency was in 2018, and it was a normal year in residency. And then from that, the pandemic hit. So half of the year of residency, my second year was normal, working in clinics and the hospital, and then the last half of the year was pretty much working in the emergency clinic just for, dental emergencies, but also working in the ER a little bit, helping out with the, workload that they had. So now I work at a private office in Red Bank, and that's my history.
Okay. What are the responsibilities and duties surrounding your job?
Sure. So I'm lucky enough to be a partial owner of the company that I work for. Obviously, like I said, I work for my aunt. So basically, my duties not only include like clinical work, like treating patients and triaging and, coming up with treatment plans, but also to, handling the business aspect of it, as well as helping with the, how we get patients and how we, present treatment plans. And so I work both in the clinical aspect as well as the business aspect of it.
What skills, personal traits, and values must you need to thrive in your workplace?
So I feel like the thing that separates dentists from a lot of other healthcare providers is that as a dentist, having a good bedside manner is very important. Working in a private office, we get to know our patients, and, we've had patients that have been coming there since they were kids and now are adults. So it's one of those things that, you have to treat a patient with respect. I've had a lot of people come in and tell me, that they have had experiences where they felt bad about certain situations with their teeth. And I think that is the absolutely wrong way to go about it. I think that everyone should know that, what they're doing now is what's best for them. And I think that no one should be judged or criticized or made to feel bad about what they do. So I think just having, an open mind and being, morally sound and, doing what's best for your patients, not only from a dental perspective, but, an emotional perspective, a mental perspective. I think that, it's a lot, because most people don't like coming to the dentist, which I know is a shocker. But I think that making, appointments a little bit easier, and people tend to, they say they like coming to see us. So that's the most gratifying part of my job.
I like coming to see you.
Yeah. I think most people do.
How does your career affect your work-life balance?
I think being a dentist is a fantastic career. I only work 4 days a week. I work 40 hours a week, but I have them in, 4 days. So I'm able to do all of the things that I love outside of being a dentist, because being well-rounded in your life, not only in your profession, but in your social life and your mental health is really important to kind of keep you from burning out or keep you from being overly stressed. So, being able to have, work in 4 days is wonderful. Another thing that is great in my personal career is I work with my aunt. Me and her are very close. She's my godmother. So that's a lot of fun. She calls it the best years of her life because we get to do it together and we're having a great time doing it. But I think finding a good balance between those two and being able to do the things you love outside of dentistry, having your profession not be all that you are is really important.
Agreed.
Yeah.
What would you say to someone who is planning to enter the field of dentistry?
100%. Do it. 100%. It is absolutely fantastic. I love what I do. I know it's not for everybody though. So if someone's really interested in, entering the dental field, I definitely say go shadow someone. The same way that, in nursing school, you have to go and do rotations to kind of see what you like to do. I think that if you're interested in becoming a dentist, that you should shadow someone and see if it's for you. I know a lot of people kind of don't like the mouth. So that is that's one thing that I think is you have to figure out. But as for the actual profession itself, it's wonderful. I love it. I couldn't be happier in what I do. So.
And that shows.
Do it.
It's recommended to visit a dentist twice a year. Why should someone go if their teeth appear fine?
So I get this question a lot from patients because, it's one of those things that I think that dentistry is almost seen in a way that it's unless something's hurting, nothing's wrong, right? But as a dental professional and as seeing someone 2 times a year, not only can we prevent, things from happening, but also too, in dental school, they call us kind of the gatekeepers because, most people only see their doctor when something's really wrong, right? But as a dentist, you can come and we can see if there's anything systemically going on because of anything, symptoms in your mouth. Also too, keeping your teeth healthy is really important to prevent infection, but also too, cleanings are really important because as good as you think you do, and a lot of people do a really great job, there's always going to be something there, right? So, preventing things like periodontal disease and preventing things like getting root canals are done because people come and see us, every 6 months. So I think prevention is the biggest thing as to why people should go. I also think that, everyone always associates cavities with pain. But that's normally not the case, so, we want to make sure that we stay on top of that to prevent you from pain. So I think you should definitely come every 6 months.
Oh, this is a good one. Hydrogen fluoride is seen as a controversial chemical. Is fluoride safe for your teeth?
Absolutely. So in my master's, when I was getting my master's degree, you have to do a thesis like every other master's program. And my thesis was actually on fluoride. But I actually chose to do my thesis more on pretty much the article or the thesis was called fluoride, the difference between fact and fear. Because there's a lot of fear around fluoride. But I think the fear comes from just not being fully educated about it. Fluoride, I think, is one of the it's one of the best things for your teeth. What it does is not only it can prevent cavities, but it actually can stop small cavities from getting bigger. Basically what it does is it mixes with the phosphate and the calcium within your saliva to create this pretty much molecule that stops those things from happening. So, there's really been no evidence of anything really going wrong with fluoride. The biggest thing that people worry about is fluorosis, and basically what fluorosis is, it's a modeling of the teeth, but it only happens in very, very high quantities of fluoride. So you'd have to eat a whole tube of toothpaste every day, so you're not getting that much. And New Jersey is actually the second lowest, or it used to be, this was, when I did my thesis, the second lowest concentrated in drinking water in the United States. So in a lot of places where they have fluoridated water, kids are getting that protection, and adults when they drink tap water. But we're not getting that as much. So especially in New Jersey, and now that bottled water is, so prevalent, I always think fluoride's great. My friends, I usually yell at my friends when they don't have fluoridated toothpaste, and they always make that joke, but I stick by it. I stand by it.
Working with laughing gas, is it possible to overdose?
It's not. No, it's not. You can get certain symptoms of, it's not an overdose, but you get certain symptoms like, you get a little bit dizzy, your ears can buzz, things like that. And that's when you've had a concentration a little bit too high. But it's actually, nitrous is up there with one of the safest. And it has safeguards on it. So all machines will not allow you to have too much nitrous versus the oxygen level, because you get them both simultaneously. So, no, it's not. Not in the dental world. It's not.
Okay. Well, thank you, Pauline.
Oh, you're
thank
very
you for
welcome.
dedicating your time.
Absolutely.
We all appreciate it.
Absolutely. I'll send you my bill.
Okay. Perfect.